Hi, I'm Mike Thomas, and I appreciate you joining this training module on hyperhidrosis. Since 2004, I've been fortunate to collaborate with the International Hyperhidrosis Society, an organization dedicated to advancing education and awareness of this complex and debilitating disease. At that time, I was at Procter & Gamble, and we worked together in the launch of the first over-the-counter clinical strength antiperspirant, and have continued to support the IHHS in their important mission to help find solutions for hyperhidrosis sufferers. Approximately 5% of the global population grapples with hyperhidrosis. That's over 385 million people around the globe. Still, due to lack of awareness among sufferers and insufficient education among medical professionals, most individuals never receive a proper diagnosis or relief from their symptoms. For those dealing with hyperhidrosis, the body's natural cooling mechanism is excessively active. This heightened activity can lead to sweating 4 or 5 times more than necessary, causing embarrassment, discomfort, anxiety, potential dangers, and disability. And beyond the physical symptoms, heavy sweating is often misunderstood as poor hygiene, as being out of shape, or nervousness, prompting sufferers to conceal their condition, even from loved ones. By adopting coping mechanisms like avoiding handshakes, layering on clothes, or steering clear of certain social interactions, sufferers are often deeply saddened and blame themselves for a condition that's out of their control, and the resulting embarrassment causes them to turn inward, hide their symptoms, and suffer in isolation and shame. Now, in just a moment, you'll hear from Dr. David Pariser, a global authority on hyperhidrosis, as he guides you through the ABCs of diagnoses and distinguishing between primary and secondary hyperhidrosis. Dr. Pariser, a seasoned professional with over 40 years of practice, has treated thousands of hyperhidrosis patients. He stood behind many podiums as a renowned lecturer on the mechanisms, diagnosis, and treatment of hyperhidrosis, having shared his insights at prestigious forums hosted by the International Hyperhidrosis Society, the American Academy of Dermatology, the European Academy of Dermatology and Venereology, the World Congress of Dermatology, and various dermatological associations. Now, Dr. Pariser isn't just a dedicated practitioner, he's also a consummate researcher, always exploring innovative treatment methods to enhance the quality of life for his patients. Throughout his whole career, he's found inspiration in the lives of hyperhidrosis sufferers, whose well-being he has significantly improved. This course will provide you with a memorable and straightforward guide to recognizing and diagnosing signs and symptoms of hyperhidrosis, along with some tips to help patients navigate their next steps. Now, on behalf of the International Hyperhidrosis Society, I want to thank you for your time learning the ABCs of diagnosing hyperhidrosis.
Hello, I'm David Pariser, current secretary and one of the founding members of the International Hyperhidrosis Society. I'm also a professor in the Department of Dermatology at the Eastern Virginia Medical School and a past president of the American Academy of Dermatology in 2009. This program on hyperhidrosis is brought to you by the International Hyperhidrosis Society. Our objectives today are to talk about the pathophysiology of hyperhidrosis and how it's classified, and to help discern between primary and secondary hyperhidrosis, and how to communicate these accurate diagnoses. So we're going to talk about this in the format of the ABCs of hyperhidrosis, primary versus secondary. First of all, let's talk about secondary hyperhidrosis. This is a condition of sweating that's caused by something else, some underlying medical condition, perhaps the side effect of a medication. And these kinds of secondary hyperhidrosis causes need to be ruled out before considering how we're going to manage the condition. And this is the first step in hyperhidrosis management. So what are those rule-outs? Well, sometimes a simple history is adequate, but if not, blood counts, basic metabolic panel, thyroid hormones, ANA, hemoglobin A1C, chest x-rays will rule out certain other causes such as infection, kidney dysfunction, malignancy, diabetes, thyroid disease, and other inflammatory diseases, all of which can be associated with hyperhidrosis. But we're not going to talk about any of those today. Once secondary hyperhidrosis has been ruled out, and the diagnosis of primary focal hyperhidrosis has been made, we can solidify that diagnosis using the ABCs. A, age of onset. Primary focal hyperhidrosis usually begins during childhood adolescence, with the exception of craniofacial sweating, which may begin later in life. If symptoms begin later in life, consider secondary hyperhidrosis caused by a side effect of medication or some systemic disease. But the vast majority of palmar and plantar hyperhidrosis, 66% for palmar and 61% of plantar, start off in childhood, less than 12 years of age. And over a third of the respondents in a survey reported that their primary axillary hyperhidrosis started before the age of 12. B, bilateral sweating. Primary focal hyperhidrosis is usually bilateral. That means the sweating is the same on both sides of the body, both hands, both feet, both underarms, both sides of the face, usually bilateral. However, over 80% of those people who have axillary hyperhidrosis will have 3 or more other sites also involved. Now, if your patient is sweating on one side only, consider the possibility of an underlying condition with the sweating showing as a presenting symptom. Also, it is possible to have both secondary and primary hyperhidrosis at the same time. Remember, asymmetric hyperhidrosis suggests a neurological cause. C, cessation during sleep. People with primary focal hyperhidrosis do not usually sweat excessively while sleeping. Primary hyperhidrosis does not usually cause excessive sweating during sleep. If your patient does sweat excessively while sleeping, consider a secondary cause. If sweating is problematic both day and night, a combination of primary and secondary hyperhidrosis is possible but not common. D, duration. To consider the diagnosis of primary focal hyperhidrosis, disruptive, extreme sweating episodes need to have been occurring constantly for at least 6 months. To make the diagnosis of primary focal hyperhidrosis, the sweating episodes need to have occurred at least twice a week. They don't need to be continuous. In fact, they usually are intermittent. They don't need to be 24/7, but they have to be chronic. Ask about the number of episodes that the patient has had per week, the degree of the episodes, and how that's affected daily functioning, stress, and anxiety. E, episodes. Extreme uncontrollable sweating will likely not be consistent 24/7. Most patients will experience frequent episodes of varying length and varying degree. These are not related to the weather, they're not related to heat, it's not related to exercise, and it's not related to stress. So ask about the number of sweating episodes per week and the effects that these have on daily function, on stress, and on anxiety. F, family. 2/3 of hyperhidrosis sufferers indicate that other family members may have it too. However, due to the shame and stigma of this condition, it may not be something that's talked about among family members. I'll give you one specific anecdote of a patient that I had, a teenage girl, who was sitting on my exam table and the mother was in the chair, and I asked the patient whether anyone else in the family had the problem. She said, no, they didn't. And the mom looked at her and said, well, honey, I really never told you, but I've been having this sweating problem all my life. And when the teenage girl chastised her mother for not telling her, the mother sheepishly said, and grandma has it too. G, gets in the way. Some level of sweating and increased sweating is to be expected in normal activities of life. But hyperhidrosis gets in the way of sufferers' confidence and ability to function, to work, to have fun, to pursue their dreams, to develop relationships, and more. Anxiety and depression are significantly more common among patients with hyperhidrosis than those without. Furthermore, it's been shown that hyperhidrosis has a deep impact on the mental health of sufferers, particularly the younger ones. 20% of hyperhidrosis sufferers report trouble using keyboards, touchscreens, mobile phones, and computers. And over half say that they change their clothes more than twice a day. 20% say they shower or bathe more than twice a day. And over a third say they spend about 15 minutes or more dealing with their hyperhidrosis symptoms on a daily basis. Sometimes having hyperhidrosis severely affects a patient's career choices. I had a policeman who had excessive sweating of his hands, who had trouble firing his gun and couldn't succeed on the shooting range. After treatment, he proudly told me that now he was able to hit the target every time. So remember, it's the A through G's with the grand finale, H, for hyperhidrosis. So of the ABCs, here are the essentials. B for bilateral and focal. C for the focal cessation during sleep, except for Palmer. D, longer duration than 6 months. E, the sweating is episodic. So I've hoped you learn how to explain the pathophysiology of hyperhidrosis and how it's classified, the ability to discern between primary and secondary hyperhidrosis and how to communicate an accurate diagnosis, And I thank you for listening to this program, which was brought to you by the International Hyperhidrosis Society.
Thank you once more for dedicating time to learn about the ABCs of diagnosing hyperhidrosis. All of this content was developed independently by the International Hyperhidrosis Society and is accredited through the Eastern Virginia Medical School. We'd like to give special thanks to Miradry for providing the educational grant, to the International Alliance of Dermatology Patient Organizations, to the Dermatology Department of George Washington University for their support, and to U360 Medical for creating the module. To learn more about hyperhidrosis and to be listed in our Clinician Finder registry, go to sweathelp.org or send us an email at info@sweathelp.org. On behalf of the 385 million people dealing with hyperhidrosis every day, thank you again for your time, your attention, and dedication to providing compassion and evidence-based care.